it's Dr. Magnifico from JaredSpillVetandPobly.com. This is Willie. He is a young, neutered male domestic short hair feline. He came to us from a colony, so he was living outside with a bunch of other kitties. And they noticed one day that he had something protruding from his rectum. He had what we call prolapse rectum, so he had actually pushed out the distal end of his colon. Typically, we see it with very young cats. Typically, it's related to intestinal parasites. The parasites cause diarrhea, and then the straining to push causes you to, if you push hard enough, you can actually push out your colon outside of your rectum or your anus, and that's what had happened. That tissue is very fragile, and it is really meant to stay inside your body. If it does not get treated very quickly, it will start to die and slough, and this can be life-threatening or it can be fatal. So they brought him into us immediately, and we replaced it, so he had to go under general anesthesia, and we had to clean it, lubricate it, and then put it back inside his colon, and then we had to do a purse string suture, so we actually closed up the anus so it has a very small hole. The big question with these guys is why did it happen? It really is not normal. So typically we'll do a fecal parasite check first, so send in a fecal sample and see if there's any worms in there. Most cats that are outside commonly have some of those, so we'll deworm them. Second of all, whatever causes diarrhea can cause you to have a prolapsed rectum, so we have to figure out why this kitty has diarrhea. He's had his rectum replaced 3 times, so we've replaced that 3 times, and we are still dealing with diarrhea. Some of these guys are straining because they're constipated. Typically, constipation is not the biggest problem. Typically, it's very young cats. We get a lot of questions, my animal is constipated, because they see their pet straining to defecate and they assume it's constipation. Most of the time it's diarrhea, so I'm always going to ask somebody, are you sure what is coming out of your cat? And I want a very good description of that. It really is very important. If this happens to you, you've got to get your pet to the vet right away. That tissue has to stay lubricated, so something like KY jelly, you have to keep it very liberally lubricated so that it doesn't dry out. My puppy, actually, that one of my dogs was brought to me when he was 10 weeks old. They had waited quite a long period of time, and he was actually very lucky that he survived. It is treatable, but you have to figure out what the underlying cause is and has to be corrected. Some of these guys we put on laxatives, some of them we change their diet, some of them we do multiple fecal samples to figure out what kind of intestinal worms they have, but the big concerning factor is what caused it and how do you stop it right away. It's not uncommon to have to do the purse string, replace the prolapse a couple of times until you get their GI tract straightened out. But it is certainly something that's treatable, but it is something that needs to be seen right away. If you have any questions about this or any other condition, you can find me at Pobly.com. I'm going to write a whole blog on him, so there's pictures of the surgeries that we've done and what he looked like when he came in, and then we will follow up with what his long-term treatment plan was. That's it. Thanks.